Hi everyone, Dr. Remy from Pain Free and Fit and Posture Science. Today we've got a great lesson for you for lumbar or lower back facet syndrome as well as cervical or neck facet syndrome in terms of learning an essential basic motor pattern of how to extend or bend backwards without hurting your facet pain. Hope you enjoy. So for those of us who have experienced facet syndrome or deal with it on a chronic basis, most of us realize that there are two basic motions that particularly aggravate facet pain, and that is extension or bending backwards, whether at the neck or the lower back, or rotation, twisting. This particular lesson is going to focus on how to extend or lean back without hurting yourself through a gross or a global spinal mobilization or stability exercise. And this is what we're going to do. We're going to begin by realizing that to check the amount of extension or to prevent it in the lower back, we need to keep our tailbone slightly tucked under. Now, how much under or posterior pelvic tilting is entirely up to your unique situation. At a certain point of tucking it under, you may feel a little pulling in your back. That's too far. If you go the other way and bring it up into the dangerous motion of tail up, pubic bone down, you're going to begin to feel your lower back at a certain point also. So you want to be right in between those two, half point. That's your neutral spine and pelvic tilting. Now, there's a lot of other alignments and positions you can learn based on a body analysis of your unique posture and body mechanics. You can do that at either the Posture Science or painfreeandfit.com websites. We've got a free body analysis, and you can learn which stability muscles need to be engaged, what do you need to avoid in terms of side leaning, twisting, pelvic position, leg and hip position, all affecting facet syndrome. But for now, let's just focus on that pelvic tilting. So we're going to put that pelvic tilt into the halfway position, which for most of you is going to be a little bit more tail under than you're used to relaxing your posture in. And we're going to use our lower ribs in the front of our body to crunch slightly down. That engages our rectus abdominis and obliques, which helps to check, meaning it helps to avoid that extension or that arching in the lower back, preventing the lower back from bending backwards. At the same time, for the neck, to protect it, we're going to pull our face straight back towards the back of our head and tuck our chin slightly under. Again, once you know your unique posture and body issues and your RPI, reverse posture isometric, on that body analysis that you've taken, you can all position your shoulder blades and head to protect your neck as well. We all have particular shoulder blade postures and dysfunctions that play a role in facet syndrome. So learning how to hold those is another essential aspect of doing this or any exercise. So once we have the head back and the chin pulled under the jaw, the tail under and a little crunch, we're now going to learn how to bend, which is by bending from 2 points, the mid-back between our shoulders and our hips. Our ball and sockets have the ability to tilt backwards without bending from the waist. And that's what we're doing. We're setting stability up first by the tail under the crunch, the head back and the jaw under, and then we're going to tilt backwards, our whole pelvis backwards from the hip. Our entire pelvis or socket is going to rotate back on the ball of the upper thigh, and you'll notice my lower back is not arching at all. In fact, I can keep my hand there to check that. As I lean back with the tail under and the ab tension, my lower back is staying stable, it's not arching at all, and the motion's coming from my hip. Now look at that ability. I'm able to lean back 20, and if I'm very flexible, almost 30 degrees with no motion at the lower back whatsoever. Now I can accentuate that by bending from my mid-back. And the way I do that is the same way. I keep the tail under in the crunch, a little face back, chin under the jaw, and I'm going to bend from my mid-back. Do you see that motion there? It's coming right in here between my shoulder blades. I'm lifting my chest, but not allowing my lower back to bend, and I'm not allowing my neck to bend. And again, I can use both hands there. So there's a certain amount of motion, not as much as the hip, that'll bring me upwards with those two motions. Now if I combine them, keeping again my stability, tail under and crunch, head back, chin under the jaw, I'm going to lean back from the hip joint. Again, I can keep my hands there to make sure my neck and lower back is not bending. Hip motion first, and then I'm going to finish it off with mid-back motion. Now look at that. That's going to train me in terms of repetitions going back and forth. How to bend is going to be strengthening my muscles that do that hold my body in stability, and strengthening the neurological facilitated coordination of being able to do that so that I can reach for things. I can train with exercises, upper and lower body, pull moves, push moves, without extending my neck, without extending my lower back, helping to create less extension stress, relieving that mechanical pressure on my facet joints. You can do this 3 times a week, putting into a strengthening program where you increase reps by 1 or 2 as you go along. You can also increase the isometric hold time of just holding 1 rep at a time for longer and longer periods by a few seconds each workout. Make sure you at least have a day or 2 rest in between workouts as you build up the strength, coordination, and flexibility of your soft tissues to be able to extend without aggravating your facet syndrome pain. If you like this series on facet syndrome extension, we have another one coming up on rotation that you'll enjoy, as well as other great videos for facet syndrome. Feel free to subscribe to our channel to get all those. If you'd like to help me share this vital information with others with facet syndrome, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them. If you're looking for a specific customized program for your own facet syndrome based on changing your unique body mechanics, muscle stability problems, muscle imbalances, go to the painfreeandfit.com website. We have the Fast Track Facet Syndrome Healing Exercise Program there. It outlines everything from analysis to stretches to strengthening and coordination exercises to get your facet syndrome back into shape and a lot less painful. If you're looking for a one-on-one consultation with me for your facet syndrome, go to the painfreeandfit.com website. We can have a video conference call between you and I where we check your posture, your mechanics, your stability, teach you which exercises are needed for your unique condition, and help you with your mechanics and pain. I hope this series on facet syndrome extension, basic motions, helps you with your chronic pain.